Hey guys! Now let's face it, high school is tough. The workload, it's like you always have homework assignments, you're trying to finish all your credits, the drama. Someone's always talking bad about someone else and you try to stay out of it, but somehow you always get caught up in it. Your friends. One friend group is pulling you this way. The next friend group is pulling you in this direction. You don't know who to hang out with. You just don't know. Your parents, they want the best for you, or they may not want the best for you. They want you to succeed. They have a lot of pressure. Your siblings, it's like there's an unsurmountable pressure. Now, it can feel like no one ever understands what you are going through. Now, I am not here to say that I completely understand your personal struggles and what you are going through at school or in your home or anything like that. I'm not here to say that. What I am here for is to give you tools in this presentation to help support healthy behaviors and coping strategies. Hello everyone, my name is Zoya Thompson. I am a licensed counselor and I am an alum of this prestigious institution. Go Eagles! Now, a little backstory of myself. Like I said, my name is Zoya Thompson. I grew up in the beautiful country of the Bahamas on a little tiny island called Abaco. For my undergrad, I went to Southwestern Adventist University that's located in Keene, Texas. Go Knights! And I also did my master's there as well. Now, I am very passionate about helping others and counseling. I love working with youth and young people and even older people alike. And my method is I try to be as practical as possible so that my clients and you guys who I'm speaking to today can actually implement these things inside of your life. I don't want it to just be something that, that may go over your head or something that you may not care to remember. I want this to be implemented into your life now. I want you to take these tools and also develop them and ingrain them into your future as well. Now, I am here to provide you guys with information that you can implement and carry with you throughout life. I want this presentation to be very interactive, so don't be afraid to come up to the mic, answer a question, ask a question. For those of you who are shy, and mind you, you don't have to be shy, guys. I don't bite. I promise. I have this little tool right here where you can actually text me the question and it's going to get screened and then it's going to come to me. The number is 777-776. Again, the number is 777-776. And I look forward to hear what you guys think and what you guys feel about the topics that we're going to talk about today. Now, would it be right if I don't start this off with a question? What comes to mind when you hear mental health? What's one of the first things that just pops into your mind? I don't care if it's wrong or if it's right. I want to hear what you actually think of when you hear mental health. It's something that's talked about a lot in society nowadays. Mental health. What actually comes to your mind when you hear the word mental health? Now, what do you think mental health is?
Besides from the obvious answer, the health of your mental status. No, I guess it's just words, am I right? No, it's everything that has to do with your brain and your emotions, which is still completely valid, because that's part of your body too, so it's part of health. So it's just the parts of taking care of yourself and looking out for that side of your health that I guess most people ignore. But yeah, so it's important paying attention to your brain and your feelings.
So what comes to mind when I think about mental health is emotional stability and depression, anxiety, or of course those are negative emotions, but also just taking care of yourself by doing things that you like to do, and stepping back and realizing that even though it's important to care about others, you can't care about others unless you care about yourself first. And just making sure that you're emotionally okay and that you're sustaining yourself enough to do the work that you know that you have to do.
Now guys, I want to give you a little example before I go in and explain what mental health is. Right now, you guys see a physical body in front of you. And if you touch your hand, you touch your limbs, that's your physical body. That's the body that you have to go throughout life with. Now, sometimes the physical body has aches, it has pains. Sometimes it can even get sick. Sometimes you can have different things like cancer. You can have different things like diabetes, different things like that. Now, mental health is our mental. It composes of emotional, psychological, and our social well-being. Now, mental health refers to how we are able to handle the stresses of life, how we relate to others, and make choices. It includes our emotional, psychological, and social well-being. Now, I'm gonna say 2 scenarios and tell me which one do you think has good mental health. Okay. Now, Susan is popular. She's a star student. She's the girl that everyone wants to be friends with. The boys love her. The girls want to be her friend. Everybody wants to ask her out to prom. Everybody wants to go on study dates with her. But Susan has racing thoughts that go through her mind all the time. Why am I so fat? Why can't I lose weight? I just want to cut all my fat off. I want to puke to get everything out. Why does no one like me? Why do people talk behind my back? Why can't I be skinny? Why can't I be like everyone else? Why? And these thoughts continue to circulate through her mind all the time. Now, no one can see those thoughts, but those are the things that goes through her mind. Now, on the other hand, we have Jack. Jack is shy. He has a few friends, but he does not rank high in the popularity competition. Now, everyone says that he's weird because he wears, old hand-me-down clothes. He wears raggedy clothes. But to teachers and his close friends, they seem to like him. They think everything is cool with him. Now, and people also make fun of him. Now, out of these 2 classmates, which one do you think has good mental health? Now, having mental health, when we hear the word mental illness, this just means that something is not functioning correctly with your mental health. Now, some forms of mental illness can include depression, anxiety, obsessive compulsive disorders, post-traumatic stress disorders, and I know these are a lot of disorders that is very popular in the media, but I like to think of it as a scale. So sometimes, for example, with depression, we can feel sad and we can have a lot of the symptoms, like our sleep pattern is out of whack. We feel guilty. We have, bad thoughts about ourselves, different things like that. But we can still function through life. We can still, it's not really affecting our everyday. It's not really affecting how we interact with others. And we just cope through it. And on the other side of the scale, the more we go to this right side, it's where the depression is more crippling, it's more severe, and it may be able to be clinically diagnosed. Now, with that is this person, they can't get out of bed because they feel so guilty, they feel so sad. Their suicidal thoughts are crippling. They actually want to harm themselves, they want to kill themselves. They feel as if they can't make it out of life. They just had enough. And when you get to this part of the scale, the mental illness is actually, it may be clinical, and you should actually reach out to someone to be diagnosed so you can actually talk to a mental health provider. The truth is, guys, all of us have mental health. Our emotions, our thoughts, our feelings. Mental illness is an illness that affects the way we feel, interact with others, and behave. All of us have our days where it's hard to deal with the stresses of life. Life is hard. Let me break it to you. It is hard. And it affects the way we feel. Sometimes we may be annoyed or just ready to quit. But I'm going to highlight some of the areas that adolescents struggle with. Okay. Now, I have a next question. Come on, guys, we gotta be interactive. What is the percentage or the ratio that you think depression is prevalent in adolescents?
I think depression plays a major role in our society, and especially as adolescents. I think more than about 4 out of 10 of your friends have suffer with depression or anxiety.
That was some good responses, guys. Now, depression. There's a high rate of depression among teenagers and adolescents. Studies have shown that 1 in 5 teenagers struggle with depression. Now, if you or someone you know has been exhibiting symptoms like I will discuss, please listen. Have you been feeling sad or helpless? Lately, you've just been an immense feeling of sadness? Have you been withdrawing from your friends and isolating from your family members? Have you just been feeling fatigued or having a lack of energy, and as a result you sleep more than normal? When you are around your friends, have you been very easily irritable, angry, and hostile with people that you normally are super close with and you love being around? Now, these are some of the symptoms of depression. And if you check off a few of these boxes, the individual may be feeling depressed. Because it is so common, we oftentimes just explain away the symptoms of depression. We say, oh no, we're just feeling sad. It's just the time of the month. She just wants attention. He just wants to be difficult. That person, he just doesn't want to be my friend. But often in these times, guys, when you see a friend socially withdrawing, that's the time when we need you guys to reach out more and to say, hey, I'm checking up on you, I'm here for you. Because you would never want someone to struggle alone when they're feeling depressed. Now, when you go through the symptoms and you answer the question, you know what, I might be feeling depressed, or this person who I know may be feeling depressed, there's a couple tips that I want to give to you guys, and I'll explain them. So you guys, they're going to be very simple, and you're going to be like, oh, that's all I have to do. No, but these are actually being shown to help. Okay, number 1, if you have been feeling depressed, go and hang out with some friends. It's simple. Now, it may be annoying at first, but actually reach out. During the times when you're feeling depressed, guys, you should not be alone. You should be around the ones that you love. You should be devoting your time to something else. If you don't have that friend group that you can go hang out with, guys, try to volunteer. Go to the animal shelter. Go pet some animals. Go pet some cats. Just go volunteer. Do something to get outside of yourself. Sometimes you may just need to take a break from the phone. A lot of times at the end of the week, when we see our analytical data of how much time that we've been on the phone, guys, it's alarming. Sometimes I see that I've been on the phone so much, and I'm like, I have to scream to myself because it's ridiculous. But guys, take a break from the phone. Go outside, get some fresh air, get some sun, go in the water, go in the pool, go in the beach. Reach out to a trusted adult or teacher to talk to. even if it's a parent, guys, just reach out to them and be like, hey, I've been feeling this way for a while. Like, I just need to talk to someone. Or what can I do? What can make me feel better? And if you have thoughts of harming yourself and you feel like you're actually gonna do it, or even if you have thoughts, guys, there's a suicide hotline, and don't be afraid to call. Just call them. It's 1-800-273-8255. And I want you guys to store that in your phone, because there may be a time where you may be feeling really down and you need to talk to someone immediately, and those people are always there, guys. Store it in your phone. I have another question. What do you guys think is the prevalency of anxiety during adolescent years? How many adolescents or teenagers or your peers do you think struggle with anxiety?
I think that the prevalence of anxiety is actually really high. I think it's higher than most people think, so I'm gonna go with like a 75 to 80%.
4 main types of anxiety disorders is generalized anxiety disorder, panic disorders, phobias, and obsessive compulsive disorder. Now today we will focus on anxiety attacks. Now, do you sometimes feel any of these symptoms? Like shortness of breath, your chest is tightening and it's hard to breathe, and with that you have heart palpitations and your heart is racing, it's racing. You feel like you have cold sweats, and all of a sudden your forehead is wet, but you're not hot, you're cold. Feeling fearful, or something is gonna happen. You feel like you're sweating now, and with an accelerated heart rate. Do any of you guys feel that way? Be honest now. You don't have to raise up your hand, but a simple nod will suffice. Now, to be honest, some of those symptoms are very common, and we live in a society where there's a lot of pressure, there's a lot of things that's demanded of us, especially during these adolescent years. The human brain isn't really fully forming until your mid-20s or so. So with the amount of pressure that is being placed on you guys at this age, some of you are 16, 17, 18, some of you even be 15, it's hard to cope with those. So I want to go through a little exercise. I know you guys will be like, are we going to do jumping jacks? No, but I want to go through a little exercise with you that can help you through these moments. Remember, I'm very practical, so I want to show you these things that you could implement as of right now. So guys, whenever you are feeling overwhelmed by your parents, by your peers, even your hormones may be off, even just anything, this is what I want you guys. It's very small. You can do it in a couple different ways. One of the ways is on your Apple Watch or any smart device, there are breathing apps that you can follow, but it's just a simple one like this. So you run your 5 fingers and you're gonna go, I want you to trace it, and I want you guys to breathe. And what that's gonna do is it's gonna help control your breathing, that's gonna help you calm down, it's gonna help you be present, and it's gonna help you to be like, hey, I'm not in any danger, I can calm down myself. So we're gonna all do it together. So let's go. And if you feel like you don't want to do it, it's totally fine. So have your 5 fingers. You can do it inside or out. It doesn't matter. We're gonna start at the bottom. Breathe in. Breathe out. In again. And try to get as much air into those lungs as possible. Breathe out. Breathing in again. And out. You're gonna breathe in again. You're almost done. And out. And this one is a little different because it's shorter. And out. And I don't know about you guys, but I instantly feel like I'm brand new. I'm calm. Now I can think more clearly. Now my heart has stopped racing. I'm more focused, I'm present, and I'm ready to take on whatever is coming my way. So guys, I also have some other tips for you. One of them is exercising. So sometimes you just need to go outside, you know, work up a little sweat and just calm yourself down. Just doing a little exercise, whether it's aerobics or running, boxing. There's so many exercises. You guys should try it. Try to eat a healthier diet, you know, probably for 1 week or so. Cut down on some fatty food or some of the extra sweets or the late night runs. Just try to eat a little bit more healthier. Practice breathing techniques and practice relaxing on purpose, not just laying down, but actually saying, okay, this is my calm time, this is my downtime. I'm going to sit inside the room with the lights off and just relax. Tell your parents, hey mom, just give me 5 minutes, let me just relax. And if the symptoms you feel are still severe, or you know that someone is still feeling a bit severe, don't be afraid to reach out and ask for help. There's people in your life that you can reach out to. And towards the end of it, I'm also going to give you guys some phone numbers and some emails of people that can actually help you. But don't be afraid to go to your teacher, or go to your parent, or go to someone and say, hey, I've just been feeling like this and I can't get it to stop. I've been trying to do some techniques, but it still feels like it's still persistent. Guys, it may not be something that you can control. It may be just your hormones may be unbalanced and you may just need to go see a doctor. So don't be afraid, guys, to reach out. So guys, my final area that I want to focus on is bullying. Now I have 2 questions that I want you guys to answer as honestly as possible. And if anyone is brave, please come to the mic and answer out loud. How do you think bullying looks in high school? Has it changed from elementary school or kindergarten? How do you think bullying looks in high school? And question number 2, have you ever been a bystander of watching someone being bullied?